Hello, this is day one of early intervention program. We'll start with review of what is applied behavior analysis after talking a little bit about autism. And then on day two, we will discuss behavior problems, behavior management strategies. And then on day three, we will talk about the role of occupational therapy in early intervention, also the role of speech therapy in intervention for children with developmental delay, and then kind of wrap it all together as 3-day training, which is being delivered online. All right, so let's get started. This is part one of our presentation. First, let's talk a little bit about autism. Autism, also known as Autism Spectrum Disorder, it is characterized by challenges in social skills, which means difficulty in initiating conversations or interaction, difficulty responding to any initiation or social interaction. Also, it is marked by repetitive behaviors, for example, hand flapping or engaging in the same behavior over and over again, which is neither functional nor useful for an individual. Also, a diagnosis of autism is marked by deficits in speech and language delay. These can be both verbal and nonverbal. Autism is a neurodevelopmental disorder and it presents with significant heterogeneity at behavioral level, where children vary and are markedly different in their level of functionings and skill, which means that one child with autism is very different from another child with autism, and there is a lot of variability within this spectrum. Hence the word spectrum. Um, there has been several attempts in research to classify or to characterize autism in various categories. Previously, the old nomenclature used to use Asperger's or high functioning autism as one way to categorize the groups based on the skills. There has also been attempts to classify autism based on verbal skills, so minimally verbal, very verbal, or atypical, things like that. When we talk about prevalence of autism, world over, there seems to be various numbers. In India, one child in 250 is reported as having a diagnosis of autism, whereas in US the number is 1 in 56. However, the research suggests that there is no specificity when it comes to any particular ethnic, economical, or racial background, and the prevalence tends to be similar across all age range and across all groups. Also, it is noted that symptoms tends to manifest around 3 years of age, and they tend to continue throughout the lifestyle. The reason why we tend to see a lot of symptoms around 3 years of age is because that is when children start to interact with other children, or there is an expectation of a child responding and emitting or showing lots of language or social skills. It is when deficits in these areas are noticed, is when teachers or parents are alerted to any kind of underlying diagnosis. The severity of the symptoms also tends to be highly variable, and it can range from very severe and aggressive behavior and very delayed language to very mild problem behavior, if any, and very mild language and speech deficits. When it comes to risk factors, gender is noted to be one of the risk factors for autism, where boys are more likely to be diagnosed with autism than girls. The ratio is 1 is to 4, which means for every girl that is diagnosed, there are at least 4 boys that are also diagnosed with autism. Additionally, there is research to support that parental age, especially father's age, can be a risk factor for a child's diagnosis with autism. Also, certain disorders and diseases, for example, children who have Fragile X or tuberculosis, Tourette syndrome, epilepsy, are more likely to also have a diagnosis of autism. When we talk about symptoms or symptoms of autism, specifically in language problems, we see that there can either be deficits or a lot of variability in verbal communication. So when it talks about deficit, we could mean that a child either does not speak or does not use full sentences, or there is a lot of variability where he might be able to speak a lot of sentences but does not use it functionally. There can be a lack of spoken language and lack of spoken communication. Also, sometimes they might develop the vocabulary but have very limited to no back and forth communication, which means I can label everything in my environment if I'm shown pictures or when I see objects. But the minute I am interacting with another peer, I don't know how to have a back and forth communication. There can also be very limited or very poor non-verbal communication. And these are things like eye contact, maintaining appropriate distance while interacting with person. Also, echolalia, whether it is delayed or immediate, along with scripting, are some of the language problems that we typically or we would notice in child diagnosed with autism. For children who are non-verbal or do not have any functional communication, we see a lot of grabbing or pulling or leading or pushing the hands of the caregivers towards items that they want or that they desire. Okay, so this is the end of part one. The next part, we are going to start talking about applied behavior analysis.